Hey guys, I'm Ashley Broussard. Today I'm going to be walking you through the U.S. healthcare system and how it's structured, and how the structure impacts equity and care. Let's be honest, our healthcare system is complicated. It's made up of a patchwork of providers, settings, and payers that don't always work together smoothly. She and Singh describe it as fragmented, and that fragmentation leads to real problems like unequal access, inconsistent financing, and uneven distribution of healthcare workers. If we want to make care fair and accessible, we have to understand how these pieces fit together and where the gaps are. Equity isn't just a buzzword, it's something we need to build into every part of the system. Providers aren't just doctors and nurses. They include specialists, care coordinators, interdisciplinary teams who do more than treat illness. They educate, they advocate, and help patients navigate the system. Mosqueda et al. Show that team based care in long term settings can reduce disparities by tailoring services to individual needs. But when communication breaks down or bias goes unchecked, those disparities get worse. Williams and Cooper emphasize the need for cultural competence and bias training to make care more equitable. Providers also need to understand the social factors that affect health, like housing, income, and education, to truly meet patients where they are. Care happens in lots of places: hospitals, clinics, long term facilities, home health, and community centers. Sahni et al. Finds that shifting care from inpatient to outpatient settings can lower costs and improve access, especially for underserved groups. Integrated models, like those described by Mosqueda et al., help reduce fragmentation and improve continuity. But she and Singh remind us that location and socioeconomic status still play a big role in what kind of care people can get. Facilities with fewer resources often serve marginalized populations, which deepens the existing inequalities. Now let's talk about who pays for care. Purchasers include Medicaid, Medicare, private insurers, and employer sponsored plans, also private pay patients. Zing et al. Found that people's decisions about insurance are shaped by how they perceive financial risk, their understanding of policies, and their socioeconomic background. When coverage is limited or people are underinsured, it hits low income and minority groups the hardest, especially when it comes to preventative and specialty care. Williams and Cooper argue that fair insurance design and policy reform are the key to closing these gaps. When purchasers prioritize value and equity, they can push providers to improve care for vulnerable populations. So, what's the takeaway? If we want a healthcare system that is truly equitable, we have to be intentional about how it's designed. That means looking at providers, settings, and purchasers and asking whether they're helping or hurting access and fairness. The system may be complex, but the goal is simple: care that meets people where they are and serves them well. Thanks for watching and for being a part of the conversation about how we make healthcare better for everyone.